Hello, I'm Dr. Varsha Kirpekar Edlavatkar. I'm MBBS DGO from Government Medical College, Aurangabad. I'm a proper gynecologist. So, I have noticed that many girls and women they have many disorders of menstruation, that is, the irregularities of menstruation, starting from puberty up to the menopause and also in the postmenopausal age. So, this is a small effort to give some advice to these women regarding these issues. Okay. Now the menstrual cycle starts now at the in the pubertal girls at 11 to 13 years of age. This is a little earlier age than before due to good nutrition and exercise, and it's a normal thing. It's okay. But if the menstrual cycle starts before 8 years of age, it is called precocious puberty. If it occurs more than 16 years of age, it is a delayed puberty. But when it starts in between 18 to 14 years of age, it is a relatively normal thing. Okay. But initial cycles are not normal. Means normal cycle it is what there is a 3-4 days blood loss. Blood loss is less than 80 ml. It's a moderate flow and it's a regular monthly cycle that is from which extend from 21 days to 35 days. That is what we call as a normal. But for normal menstruation to occur, there has to be a proper ovulation, that is ovum formation. So I will draw a diagram which will explain this better. Okay. So see, every girl or the woman has, this is the uterus, this is the birth canal, these are the two fallopian tubes, and these are the ovaries, this is the uterine cavity, and this is the lining of the uterus. Okay, so for every month there is formation of one ovum or stree beach. We call it as ovulation. When this ovulation is normal, then only normal menstrual cycle is possible. But in these pubertal girls, this ovulation does not occur properly, and so only one hormone acts on the uterus, and that is the estrogen. Okay, what is the function of this estrogen? This causes the thickening of this lining of uterus. This is called endometrium. So there is uncontrolled growth of endometrium. There is another hormone called progesterone which is secreted after normal ovulation. But when ovulation is absent, there is no formation of progesterone, and so this uncontrolled growth of this lining of uterus is not controlled, and there is excessive menstruation in these pubertal girls. This excess menses is called as a puberty menorrhagia. So many girls suffer from this puberty menorrhagia, that is the excess bleeding which may be more than 80 ml, it may last more than 7 days, or there may be passing of the clots. All these are abnormal. But I have noticed that many mothers think that these are the initial cycles, some heavy loss is expected, and they do not seek any treatment. But this is wrong. This should not be done. We can give these girls medicines to and prevent this excess blood loss. So consult the nearest gynecologist for this. This excess blood loss also makes these pubertal girls anemic. Now they have hectic schedules, all these girls, studies are going on, sports is going on, and this anemia may make them miserable. Okay, their hemoglobin must be more than 12 gram percent, and all these girls, pubertal girls, must be given iron supplements 3 months in a year, even if they do not have menorrhagia, because it's a growth period, and protein, iron, carbohydrate, everything, all requirements, they grow or they increase, so they should be properly provided. Okay, so these girls should also be get investigated. The some simple investigations must be done of each pubertal girl, like hemoglobin or CBC, urine routine, blood group, and serum TSH, that is for thyroid. Because sometimes hypothyroidism may be a cause of this excess bleeding or puberty menorrhagia. Okay, this, as I have explained this about the ovulation and hormones, it's a physiological thing, but the menorrhagia can be controlled with the drugs, and it must be done with the proper advice of the gynecologist. Okay, but there are some other causes. If the girl or the patient doesn't respond to the mm, treatment, proper treatment, then we have to look for other causes of puberty menorrhagia, like PCOD, that is polycystic ovarian disease, or hypothyroidism, or the rare causes like coagulation disorders or say leukemia, etc. And in that case, the treatment will depend on the cause of menorrhagia. Okay. So the now some girls, they also suffer from pain during menses, that is called dysmenorrhea. I have advised the urine examination because some girls have urinary tract infections also. Okay. Then some girls have absence of menstruation, that is called as amenorrhea. So these problems one by one we will be discussing in next videos. Okay. And till then, think over it and lead a healthy and disease free life. If you like my video, do subscribe and comment on it. Okay, till then, goodbye. Stay healthy and happy.